Namaskar. I am Dr. Charulata Bapaye, and I welcome you to the 238th episode of Gyan Pravah, a river of knowledge started by none other than our beloved President FOGSI, Dr. Sunita Tandurwadkar. Madam, as we celebrate the second day of Navratri today, you and me both in red, it feels nice. I think we can see woman power right over here. Madam, I'm really blessed to be a part of your team, and all of us keep getting encouraged by the numerous achievements, the numerous targets that you set for yourself. And even if we can reach to a small extent up to there, we will feel really blessed and honored. So I take this opportunity to congratulate you on all the achievements of the recent past, ma'am, all the degrees and fellowships that you've been conferred upon, the governor's felicitation of which you received. And I really request you to say a few words regarding that.
Thank you. Thank you, Charu. And thank you for your kind words. And Dr. Raghu Ram, sir, we are so honored and blessed to have you on our FOGSI platform. It's always a great pleasure. I know every day, 8 p.m., the podcast, which my chairperson, they are the reason why this is successful, because every time they come out with the faculty, they come out with the podcast, which is better than their own previous month. And the way everyone is evolving this program, taking it to the sky high, getting the faculty of a absolutely unbelievable stature. And I joined 8 o'clock, sir, just to show my respect to the faculty. Audience, they know me probably by now, but most importantly is the time what you give to FOGSI. It's our honor. We feel grateful. And I just joined at 8 p.m. to show my complete respect to you, sir. So thank you so much on this FOGSI platform. I'm sure Charu, the intelligent orator herself, will take the dialogue with you, the podcast with you in a very beautiful way. Also, I would like to say, and that's what I was saying was, this podcast was designed keeping only chairpersons in mind, thinking that they are our future leaders and they need to share the complete screen with the faculty. They should be able to take the interviews. These are the leadership qualities they should develop. But believe me, sir, I became more enriched meeting 240 faculty. I am more humbled than any ever seeing the amount of work people do. We live in a very small cocoon of OBGYN, but there is so beautiful world and so many people doing great work, and there is so much to learn from every one of you. So thank you for being in our Gyan Pravah podcast series, which may become a historical, but you will be the part and you are the reason why it will become a history.
Thanks very much, Dr. Sunita Tandurwadkar. I think it's an amazing initiative. Very grateful for this very kind invitation and delighted to be invited to participate in this podcast. And hats off to your initiative for running this program throughout this year, which certainly is unique.
I know. And when they send me your biodata to read, sir, I feel so amazed. I'm going to meet the personality of that. So it's my honor and a fortune as well. So thank you and enjoy the podcast, Charu. All the best. I'm sure it will be one of the most beautiful, and I'll be joining the viewers link to listen to both of you.
Thank you. Thank you, Dr. Sunita, for your presence. We understand that you are very busy, and in spite of that, you are with us today evening. Thank you once again. Thank you.
Thank you. Bye.
So, dear friends, today we are honored to have a guest of immense standing in the field of breast health. Dr. P. Raghu Ram, OBE, Officer of the Most Excellent Order of British Empire. An accomplished surgeon with so many degrees and honorary fellowships, not only from India, but all across the world. Edinburgh, Glasgow, Ireland, USA, Sri Lanka, and China. Rightfully, his immense work has been recognized by the Indian government, and he has been bestowed upon with the Padma Shri and a Dr. B.C. Roy National Award. He is the founding director of the KIMS Usha Lakshmi Center for Breast Diseases, Hyderabad, and the founder and chairman of Usha Lakshmi Breast Cancer Foundation, Hyderabad. He was also instrumental in bringing together the surgeons practicing breast surgery. And, he collected them under one platform. And that is how today we have the Association of Breast Surgeons of India. Sir, so many immense things in your biodata, which are going to unfold slowly and steadily. I really take great pleasure in welcoming you to this dais of Gyan Pravah. And thank you so much for joining us here today evening. So, as we go through your biodata, your accomplishments, I see that you have degrees from all across the world. You've been trained in so many different places. So, two main things come to my mind. One is that you initially trained to be a surgeon, and in spite of that, you decided to stick to breast health. That is something, at that time, it was quite unheard of, absolutely unheard of. And the second thing is that people with so many degrees, so much of intellect, so many, titles, they tend to practice outside our country. What got you back to your motherland? This is how I would like to, start my podcast with and find out what made Dr. Raghu Ram come back to India.
So thank you very much indeed. Whatever you have said is all because of grace. It's not because of me. It is because of grace. We are all mortals, and we say nimitta matra. So we are all instruments, in the larger universe. So basically, after completing my basic surgical training in India from Kasturba Medical College, having obtained first place in the MS examinations from the Kasturba Medical College, Mangalore, a fire in my belly took me to the UK, and I obtained FRCS from 3 out of the 4 Royal Colleges within 45 days. And that's when, in the UK in 1990s, breast surgery was evolving as a distinct subspecialty. In 1988, the NHS introduced the breast cancer screening program. And in 1990s, breast units were established across the country. And oncoplastic breast surgery, which involves removing the breast lesion and reshaping the breast, ensuring good cosmesis, of course, with adequate clearance, was developing in the United Kingdom in several centers. That's when I was training with Professor Robert Mansell, who was one of the pioneering figures in breast surgery in the United Kingdom. And in fact, his almanac trial, which he led to the widespread implementation of the sentinel node biopsy program in the United Kingdom.
Right.
So I moved towards breast surgery and started training in breast surgery. In fact, in early 2000, the Association of Breast Surgeons in the United Kingdom, in partnership with the Association of Plastic and Reconstructive Surgeons, developed 9 oncoplastic fellowships across the country. And I was probably one of the first Indians to have obtained this oncoplastic fellowship. And during that time, my parents had come for a holiday, and to cut a long story short, my mother was diagnosed with breast cancer. And being the only child, I was certainly profoundly affected. But I wanted to come back to India and look after her, much as my parents told me not to. At that time, in fact, my wife, who's a fertility specialist, she was doing much better than me. She had completed her, structured training in obstetrics and gynecology and subspecialty fellowship in fertility, and she was offered a job in Harley Street in London. So we left everything lock, stock, and barrel and relocated to India in 2007, not only to take care of my mother, but also to serve my motherland in various ways, which I think we can discuss.
Absolutely. That is what I realized, that maybe your mother had to play some role because, it is Usha Lakshmi Breast Health Center. So probably that was your mother because of whom you came back. So the point is that, it must have been quite tempting, initially when you're a trained surgeon, to want to do this and to want to do that, a little bit of colorectal, a little bit of head neck, a little bit of something else, because a surgeon is trained to do so many things. but to restrict yourself to a niche specialty, I think at that time, at least today we have fertility specialists, or today we have people doing fetal medicine, or those who are doing high risk pregnancy. So today super specialization or niche practice is a known thing, but that time niche practice was just not in vogue kind of. So no temptations ever to switch from breast health and include many other things in your portfolio, Dr. Raghuram?
Yeah, so yeah, it's a good question. In fact, when we obtained higher surgical training, which was a structured training program leading on to becoming consultant, you got to do everything. But when I decided to stick to breast surgery, I wanted to stick to breast surgery, and I just didn't want to come back and practice as a consultant breast surgeon. I had plans. I actually took 3 years to plan as to what I should be doing back in India. So one of the things that I realized, obviously, as all of us are aware, is due to lack of awareness and absence of a robust screening program, more than 60% of breast cancers in this country present in the advanced stages. We didn't have the concept of specialist breast units, specialist surgeons who have trained in breast surgery, or breast radiologists. There was no concept as such. We didn't have a surgical society where surgeons practicing breast surgery come under one umbrella organization. Like in the UK, there was this Association of Breast Surgery, and in America, the American Society of Breast Surgeons, which is in fact the world's largest breast surgical society. So I came back with a few goals. The first goal was to set up a not-for-profit charity in my mother's name, the Usha Lakshmi Breast Cancer Foundation, to create that much needed awareness and break the taboo associated with breast cancer. And secondly, to try and work alongside the government and implement a population-based screening program. And thirdly, to bring together like-minded surgeons. There are many distinguished surgeons, many surgeons who are very skilled, and I wanted to bring together some of these surgeons who are practicing breast surgery under one umbrella organization, and we were able to mobilize 56 surgeons, very highly reputed surgeons from across the country, and we formed this Association of Breast Surgeons of India as well. And my wish and desire is that in my professional lifetime, I'd like to see breast surgery evolve as a distinct subspecialty.
Fantastic. Looking at the amount of work that you do, we really wonder whether you have 26 or 28 hours in a day as opposed to our 24 hours. And I'm sure with your passion and dedication, I'm sure you will definitely be achieving that soon, Dr. Raghuram. And so I feel that I have just been in the field of breast health as the chairperson of the Breast and Puerperal Health Committee of FOGSI for the last, say, 5 years. But you have been in this field for like so many years, like, close to 30 years now, I think. And what change do you see as far as breast health or breast cancer is concerned in the Indian scenario? Like, all of us think that we are trying to do our bit, but is this making any change in the scenario of breast health in India? Because unless you're able to quantify something, like you really sometimes question yourself, like whether all those CMEs, all those meetings, all those rallies, or all those walks against, for breast cancer awareness, are they making any sense, or are they making any change in society? I think you should be the best person to be able to answer this, Doctor.
Certainly, there has been a very positive change. I can certainly say with hand on my heart. When I came back to India in 2007, breast cancer was so much of a taboo issue that even in a city like Hyderabad, when we would organize, say, an awareness session, we would have 3 or 4 people coming there, that too in an elite community. But today, when the foundation goes out to do awareness programs, it's no longer a taboo. People come, a minimum of 100 people turn out, and they ask questions unreservedly. Even if there are men in the audience, they ask questions. And so that taboo, certainly in urban India, is broken. And with the Pink Ribbon campaign that we did, like the Pink Ribbon Walk, we are coming up to October Breast Cancer Awareness Month. We launched the Pink Ribbon Walk, where breast cancer conquerors, we don't call them survivors, conquerors, along with their families and the community at large, walk to create awareness and salute breast cancer survivors. When we started off in 2007, we had about 50 people joining us, just friends and family. And,
Right.
as it progressed, thousands upon thousands of people participated, not only in what we did in Hyderabad, but in neighboring cities like Warangal, Vijayawada, Vizag. So, and also we started illuminating monuments in pink, where people started taking notice about it. And we got an invitation from the Raj Bhavan to illuminate
Ah,
Raj Bhavan as well in pink for the last 5 years. So that
my
has
God,
been a really positive thing. But
that is so
what
awesome. That is so awesome. I think we have a slide over. Yes. Is this the one, Doctor?
so
I'm unable
that
to.
is Buckingham Palace in pink, and of course, you've got many monuments illuminated in pink.
Oh,
In Old City, Charminar, we have Charminar, where it's so much of a taboo there, and it takes so much effort to illuminate it on the ground. Getting permissions is easy. Getting it illuminated on the ground, and probably the only city, Hyderabad is probably the only city in the world where several monuments turn pink in October to create awareness. So certainly we have created that awareness, and I think there are two aspects I'd like to highlight. After we started doing the Pink Ribbon Walk for breast cancer awareness, several other organizations and hospitals have started doing the same thing, and also not only for breast cancer, but for other diseases that merit that much of attention as well. So we have
really?
been able to inspire a change not only for breast cancer, but also for other diseases. And when Amitabh Bachchan ji in his KBC show a couple of years ago, 3 years ago, he put up a slide, a question to the celebrity guests, Kajol and Revati, as to in which city monuments are illuminated for breast cancer awareness.
My
And they gave the right answer, of course. So it
God.
has become a national phenomenon, in the sense awareness has spread. And when I went to meet him in 2017, requesting him to launch the world's first mobile app on breast health that we launched in English and 11 commonly spoken languages, he was already aware about what we were doing, and he very happily endorsed the mobile app without taking any remuneration.
My goodness. So, I mean, a big round of applause to you, Dr. Raghu Ram, and also to Mr. Amitabh Bachchan for doing that. Because no remuneration is something unheard of in amongst those people. But I think that this fantastic idea of illuminating the monuments in your city, I think the month of October is just around the corner. If all of us decide, that we should encourage our own local corporators to illuminate the big bridges or our important, the Mahanagar Palika building. I'm sure it would be a step ahead. And Dr. Raghuram, this was a fantastic initiative, and we really hope that the entire country gets painted in pink in the month of October soon enough, thanks to all your efforts. I think that is.
I must add here that it's not easy to get these monuments illuminated. It's not enough to have the will or have the influence to get the signature on the dotted line. It's on the ground. Every year I go to Charminar,
Uh-huh.
and the effort that goes, to, so many hassles on the ground,
Oh
which
my.
I can write a chapter about. So
Oh
that
my.
is one aspect. The
Oh,
other aspect is when you said, what is the palpable change? When we established the breast center at Kim's hospitals, every day people used to go and meet the chairman of the hospital, dissuading him to allow the breast center to continue. They said, what is this breast center? We know that there are cancer centers, but what is this breast center? The breast center concept is not a cancer center. It's not just another breast cancer center. It is a center where women with breast health issues, as you're aware, 9 out of 10 women don't have cancer. Only 1 out of 10 has cancer. So the aim of the breast center is to reassure the worried well. They're worried because they think they have cancer,
right,
but through the process of triple assessment, we're able to reassure them within an hour that they have cancer or they don't have, and they
right.
are counseled well. That is the concept, and it is done by specialists who have been trained in breast disease. Whether it's the surgeon, the radiologist, the pathologist. So we've been able to develop that service
Right.
over a period of time. When we started establishing the country's first full-field digital mammography system alongside Tata Memorial Hospital in 2007. At that time, the cost of the machine was 2 crores, whereas you could get a conventional mammogram machine for 10 lakhs. So the board of directors of the hospital said, what are we doing? Why are we investing so much? So I said, we're investing in early detection. And majority of women in our country are diagnosed with breast cancer at younger ages, between 40 to 50 is the peak incidence, where the breast is dense. That is where digital mammography scored. So at that time when we established it, people ridiculed. And now so many centers across the country have adopted it. Similarly, several breast centers evolved over a period of time. So certainly we've been able to make that change, that difference in urban India.
I'm sure, I'm sure. And I think there has even been an awakening amongst our women. I think they are becoming a little more breast aware. And are they coming by chance a little earlier than what they used to do once upon a time? Like, we all hear that the average size of the breast lump used to be 4 to 5 centimeters at the time of diagnosis. Is that the condition today also, or is there a slight difference in the early diagnosis part of it?
I can say in my practice, because I don't have statistics, because we don't have robust statistics.
Right.
Certainly, women now come to the breast center and many other centers in Hyderabad and other places asking for a screening mammogram. This never happened before. And that has happened because of the awareness that we have created that screening mammogram saves lives and early detection saves lives. And a lot of women are presenting in early stages. And those who present with locally advanced breast cancers as well, in this day and age of neoadjuvant chemotherapy, we're able to conserve many breasts. We're able to do breast conserving surgeries, which was not possible before, and it can be done very aesthetically as well. Of course, we may not be able to conserve all the breasts, but the incidence of breast conserving surgery also has significantly increased in our country. And the Association of Breast Surgeons of India is doing a lot on this front, because even we recently had our annual conference. 40% of the scientific content was focused on oncoplastic breast surgery. So today, oncoplastic breast surgery is one of the most, challenging and, interesting aspects of breast surgery that is being practiced, and it is being discussed, debated, and many new centers are coming up. Many surgeons who are trained in breast surgery are taking this up across the country. And as I speak, I'm really grateful to the Association of Breast Surgeons of India and the leadership over the past 13 years for developing many surgeons, for getting many surgeons interested in this breast surgery. And we have become one of the most successful sections of ASI. So when we wanted to form this Association of Breast Surgeons of India, I didn't want to form a separate association like the American Society of Breast Surgeons or in the UK. I wanted this to be part of the larger body, which is the Association of Surgeons of India.
All right. Okay.
We wanted to form it as a section because majority of breast surgery in our country is done by general surgeons. So I wanted the general surgeons to get access to the ABSI and involve them much more. So by getting involved, by being together, I thought is much better than forming a separate association. That would have been very easy, but it was a Herculean task, of course, to get it approved as a section of ASI. It took me 4 years, and our colleagues are all aware about it. But it has been a blessing, because we've been able to inspire a number of general surgeons to take up breast surgery as a subspecialty.
I think, I really must, appreciate the efforts that you have taken to keep everything together, just like the previous Indian joint family, where there are so many advantages of being together, because it is so easy to break away, doctor. Breaking away takes hardly any time. But we know that there could be problems in that, and just your thought process of keeping it all under one roof, under one title, and having a subtitle. I mean, that is really interesting to note that, it just shows your mindset, your thought process, your idea of taking everybody ahead with you, because although there is a leader, who's a true leader is somebody who takes everybody along with him. And I think that's exactly what you are, Dr. Raghu Ram. And really, we are blessed to have you here today on our podcast. But there is one,
Collective effort. It's always a collective effort.
I
It's a
think,
team effort. So no
excellent.
single person can make a change.
Well said, sir. Well said. But there is one problem which we always keep realizing, that in such a highly populous country like India, we realize that there are such few women either who have access to the mammography, or who know about mammography, or there are trained people to read the mammogram. So, in India, can we think of any other method for screening of such large populations, like whether the clinical breast examination, whether does it stand the test of time? What do you think about thermography? What do you think about AI for all these these broader because there are so many of us, and the hands are so few. So this is something
So
that
firstly, we are all aware that early detection saves lives. And we are all aware that several randomized controlled trials over several decades has shown that screening mammograms saves lives. So in a country like India, where 70% live in rural areas and only 30% in urban areas, we can't introduce a population-based screening program by way of mammography because, majority live in rural areas where they don't have access to mammography. We don't have enough radiologists or radiographers, and we are not able to implement that. And majority of our population, if you look at it, 87% of our population is under the age of 50. Only 13% of our population is over the age of 50, where screening mammography really works.
right.
So in an urban setting, actually, we are now in Navratri. It
Yes.
is the duty of the men in the house to ensure that our women, whether it's the spouse, the mother, the sister, the aunt, the grandmother, have a screening mammogram every year. It is our duty to ensure that the women in our household get the mammogram, because the woman is the nerve center for the family. If
Yes.
she is well,
Yes.
everyone will be well. And
Yes.
so this is very important. But in rural areas, we cannot do screening by way of mammography. And there is ample evidence now that clinical breast examination
Right.
performed by a trained healthcare worker who works with the government, the ASHA worker, the ANM, if they're trained well, we can implement a population-based screening program. And we have done a large-scale screening program in partnership with the government of Telangana and Andhra Pradesh. And this program now is part of the larger screening program that is being undertaken across the country alongside oral cancer and cervical cancer screening program through the National Health Mission. But sadly, only 1% of our population is being screened either for breast, oral, or cervical cancer. And we are now in the process of identifying the barriers for screening through a study which is being done in Telangana region. So
Okay.
that's as far as screening in rural areas. Clinical breast examination is the way forward at the moment. And of course, those of us who can afford a mammogram, there is no doubt opportunistic screening by way of mammography over the age of 40, at least once in 2 years must be done. And you're talking about thermography. I must reiterate that on behalf of the Association of Breast Surgeons of India, and I have seen also a statement put out by the Breast Imaging Society of India as well, it is of no proven value. It must not be encouraged. I do get a lot of calls about thermography. A lot of patients who are educated ask about it. There is absolutely no role of thermography in screening. As far as artificial intelligence, you mentioned, yes, it is one of the exciting aspects of breast imaging, and it is being increasingly used, particularly in European countries. Some of the European countries have adopted it in the screening setting. And according to the American College of Radiologists, about 9% of centers in America apparently are using AI, of course, assisted by guided by the radiologists. And
Right.
several studies are coming out showing that it is a very highly sensitive way of picking up early cancers. the accuracy is high, the false positives are low, and it actually saves time, and it is being increasingly used in many centers. Of course, it cannot replace a radiologist, but certainly in places, particularly in rural areas like rural India, if we were to establish, mammographic centers, then artificial intelligence will come in very much handy. And the future, of course, as I mentioned to you, in our informal conversation, liquid biopsy is the way forward. And, liquid biopsy is a non-invasive way of detecting breast cancer through a blood test, by looking at circulating tumor DNA or circulating microRNA. Those signals are picked up. We are actually involved along with the Indo-American Cancer Center. We are doing a large study, and a study which involves about 500 women, where we have divided them into normal women, those who have benign breast disease, and those who have breast cancer. And now we finished 234 samples, and now we're blinding them. And we must ensure that the pickup rate in normal women who present for mammogram and those with benign breast disease must not be positive. And obviously those with breast cancer must be positive. The time will answer, but I think that's the future. And if that really comes in, then blood test, simple blood test will be the first, way to assess whether someone is likely to have something. It won't obviously replace mammogram or ultrasound or a core needle biopsy, but certainly it will be the first step, and it will be an easy step, and it will be cheap, and it can be implemented in rural areas, particularly where 70% of our population reside.
I think all our viewers are going to, benefit so immensely from today's podcast because of all these new things that we are talking about. And whenever we think of that there is a ray of hope for early diagnosis of something as dreaded as breast cancer, I think, sir, you will go still long way in helping out mankind if this revolutionary blood test really works, and y'all can prove it, and then it will definitely change the face of early diagnosis of breast cancer. So best wishes to you and your team, sir, for going ahead with this entire project, and we will wait for its results with bated breath. So this was all about the mammography and the clinical breast examination. And now we all know that this breast self-examination, I again, in our informal talk, you were not very comfortable with this word. So could you just highlight for the benefit of our viewers whether the self-breast examination does anything? Is it of use at all? And, if not, how do we look at it?
It's a good point. Actually, breast self-examination and breast awareness are very loosely used words. The concept of breast self-examination is a repetitive monthly examination of the breast to a fixed method. And this concept is proven, it's not proven to be effective. It has been replaced by breast awareness. In fact, in the United Kingdom, since 1991, the NHS stopped using the word breast self-examination. And also, this is all based on several studies that have been done. The largest study is the Shanghai study, which is a randomized controlled trial involving about 260,000 women who were randomized to having breast self-examination, and the other group were just informed about the early signs of breast cancer. And these two groups were followed up, and there was absolutely no difference in the survival. However, those in the breast self-examination group became paranoid. There were more biopsies done, unnecessary surgeries done with no benefit at all. And then there was another study, large study that was done in Russia as well. It was a population-based study involving 120,000 women. So nearly 500,000 women were assessed, and subsequently many centers, even in Europe and in America as well. In fact, I was recently looking up, the American College of Obstetricians and Gynecologists also have given an advisory about breast awareness and not breast self-examination. And places like Stanford, Johns Hopkins, they now use the word breast awareness. And in United Kingdom, you don't use the word breast self-examination, but in India, we use it very often. So breast awareness is we encourage women to know how their breasts look and feel throughout the month. Throughout the month, the breasts change, and whether it is whilst having a shower or applying a lotion or wearing undergarments, all that needs to be done is to look for certain changes, like if there any change in the size of the breast, any thickening of the skin, any puckering of the skin overlying the breast, if there is any retraction of the nipple, any blood-stained discharge from the nipple, any painless lump in the breast. If these are there, not to panic, but to go to their doctor. And it is very important to do a triple assessment, which includes clinical examination, mammography and ultrasound, and an ultrasound-guided core needle biopsy, and not an FNAC. A lot of times we see women referred to us with an FNAC report. We see this even in urban India, and we see a lot of women undergoing unilateral mammograms just on the side where they have symptoms, not on the other side. So I think also it's a good opportunity for me to highlight that the first port of call for most women with breast health issues is a gynecologist.
Yes,
And I think it's very important for FOGSI to collaborate with the Association of Breast Surgeons of India and the Breast Imaging Society of India, so that we can jointly have CME programs, and we can even have joint sessions in our annual conference alongside FOGSI. And we can probably take this initiative, with the support of our very dynamic, of your dynamic president. We should be able to, come together, because coming together will really make progress on this front. We'll be able to empower the gynecologists and sensitize them to various latest advances, the nuances relating to various aspects of breast health, what to do, what not to do as well. If we can do it on a regular basis, because our country is huge, we can do it, and you have so many chapters, and we can actually collaborate with you in doing this in different states across the country, and also during our national meeting as well.
Oh my God. Once again, a big round of applause to you, sir, for putting forth this thought process of collaboration between the Breast Surgeons of India, the Association of Radiologists for breast health, and of course FOGSI, because we are a 50,000 strong community of gynecologists. And as you rightly said, we are the first point of contact. So if all of us get trained in breast health to some extent, at least we should be able to understand as to how we move ahead with this particular woman, and how can we alleviate her symptoms, whether they are in the high risk category or not. That will also help us to put our patients' minds at rest and make sure that she receives the right kind of treatment as far as breast health is concerned. And we shall definitely take this forward, Dr. Raghu Ram, and let us see how best we can move ahead in this. And so when you were talking about, that when the woman is wearing her undergarments and things like that, last year when Dr. Jaideep Tank was the president of FOGSI, we have put forth a mail forward to the government of India, requesting them that 90% of Indian women wear undergarments supporting the breasts, the brassiere. And if the packets which they come in are usually plastic packets, so can we have a little bit about breast awareness printed on this? Dr. Raghu Ram, what do you think about this? And I really feel that, whether something can be done regarding this, do you think it will be of any help?
It's an excellent suggestion, because when a woman purchases the undergarment, she would naturally have to open the packet. And so I think one-liners would be good. I think too much of explanation will be dissuading them. Say, early detection saves lives, or are you over 40? Have you had your mammogram yet? Something like that, and we can have different captions, just one-liners, just in one line, and placed prominently where it is just open. So that's an excellent suggestion. I think you should definitely pursue that, and give credit to FOGSI for that.
Yes, we will definitely need your help for that, considering that you work just hand in hand with the government. And coming to the recognition by the Indian government, we move ahead to your Padma Shri. So, how did it feel? How did it happen? I mean, we are, uh, all lesser mortals are obviously in awe of such a high degree being, of what you say, being bestowed upon you. And how was the experience? How did you feel?
Actually, these awards, recognitions, whatever honorary fellowships, it is a constant reminder because I spend 2 hours in the prayer room every day
Oh my.
and I reflect and express my gratitude on a daily basis because it is not just me, it is the teamwork that has ensured that we are recognized. We've all, you and everyone, all of us have excelled in our professions in various ways. And to get a pat on the shoulder from the Prime Minister of India, for him to, because it was the first Padma Award ceremony during our Prime Minister Narendra Modi
Oh,
ji's time, and he recognized every single person there. And when he saw me, he asked me to write to him about the screening program that we had implemented in Telangana and Andhra Pradesh. And within 48 hours of me writing to him, he put me in touch with the Union Health Secretary. A technical advisory group was formed, and the Pan India breast cancer screening program was formalized. So that's the Prime Minister we have. As you can see, the Padma Awards that are being conferred since 2015 till now, there is a striking difference in the way, and every single award that is given has the Honorable Prime Minister's stamp on it. So after I received that, and just last year, 9 years later, I had the distinct opportunity to meet him one to one and spend 20 minutes with him. I had written to him as to how we could improve breast cancer care in the country, and that was just an email. And one fine morning, I got a call from the Prime Minister's office asking me to be made available. And it was just supposed to be a 5 minutes, one-to-one meeting. It went on to 20 minutes. And even then, I had to conclude because I was feeling guilty of taking so much of time. So I said that I'm taking so much of your time, and I concluded the meeting rather than him. So it was very humbling, and for the Prime Minister to follow me on X platform subsequently,
wow.
these are unforgettable moments in one's life, and I'm truly grateful to the
Yeah.
divine force.
I'm feeling, so honored even to sit in your virtual company, Dr. Raghu Ram.
We're
Genuinely,
all achievers in our own right.
feels
We
very
all achieve in our own way, and I'm sure all of us who are watching this program as well. We're all achievers in our own right, and these awards and rewards are made. One is expected to be even more grounded, and this also is a reminder to me to have a greater responsibility. And that's why I've adopted a remote village in Telangana. And through personal philanthropy, I've been trying to change the lives of so many people who are less fortunate. So the force has given me the opportunity to go beyond just breast cancer care. And that is really satisfying. But the most satisfying thing I can say is, having lived in the UK for 10 years and now 18 years in India, the greatest satisfaction has been the opportunity to take care of my parents when they needed me the most, because
yes.
they were there for me when I needed them the most. So if I was in the UK, I could not have done that. And my parents refused to come to the UK and settle down there. So that has been the greatest fortune. And also, the second, obviously, is to be able to serve one's own motherland. There's
Yes.
no other happiness that one can get. And even if I had lived a lifetime in the United Kingdom, I would not have got this kind of satisfaction. And to that, every single day, I express my gratitude to the force.
That is really, really so amazing to hear from you, Dr. Raghuram. And I think serving your mother and your motherland, uh, you have done everything that a righteous son can do. And we take this also very positively. This is another thing that we must learn from you is giving back to society. And what you're doing in this remote village and helping them out with your own expenses really makes one realize that we are what we are because of the society, and we have to give back our best to the society. And that is another lesson learned today, Dr. Raghuram. We are really so happy to have shared this platform with you. And I think that you must be having so many future plans, so many bigger things on your platter. So anything that you want to, just
So
share?
I would just like to say that to me, there is much, much, much more to life than just practicing the art and science of breast surgery to me. So I want to do much more work in the community. I want to contribute much, much more to the betterment of the community. I've started off with my village. There's so many things to do. When one goes to the village, you realize how fortunate we are. And, in the village, for example, the village I adopted, there is no crematorium for about 20 kilometers. When someone dies there, they carry their loved ones for 20 kilometers. So we built a modern crematorium there, and so many such things. So there is so much that we all can do. And in fact, I would like to take this opportunity to request all of you watching to adopt a village. We have so many villages in our country. We have 6 lakh villages, I think. And if 6 lakh citizenry are able to adopt one village, and you don't need to do everything, whatever you can do, if you
Yeah.
can do for the betterment of the village, because that's where 70% of our population reside. That's where most people, don't have facilities that we enjoy. If we are able to do something to better their lives, then their next generation will be more empowered, and they will be educated, they will be more successful, and we would have been responsible to raise a generation. So I
Wow.
think essentially what I want to do, I want to reach out, I want to do more community work, more service.
I think we will allow these beautiful words to ring in the ears of all our viewers. And we will, want to end on this very beautiful note. Dr. Raghuram, thank you so much for having joined us on this podcast series of Gyan Pravaha. Once again, we thank Dr. Sunita Tandurwadkar, President FOGSI, for having given us this opportunity to have such a great personality with us today, and for me being able to interview Dr. Raghuram on this particular podcast. Support team, we thank you for your reassuring presence all the while. And Dr. Raghuram, best wishes to you. May the God Almighty bless you with a lot of health and happiness, and a further vision to do something better for the society. And we hope that we also inculcate a small part of what all you have just let us know. Thank you very much. Thank you. Have a good evening.
Thanks very much, Dr. Charulata. And through you, I would like to express my gratitude to the President and to the members of the FOGSI for giving me this opportunity to share my thoughts. Namaskaram and good night.
Thank you.